All right, this is Big Picture Anatomy with a look at the pattern of blood flow through the heart and the cardiac cycle, or how the heart pumps the blood. So let's start out by taking a look at that blood flow through the heart. And what we're going to be looking at is the pattern of blood as it comes to and from the systemic and pulmonary circulation, and then is pushed out, respectively, the pulmonary and systemic circulation. So to start, let's just start on the right side of the heart, where we're going to see the blood returning from the abdomen and the lower limbs via the inferior vena cava. Excuse me. This is blue. It's indicated in blue because it's deoxygenated blood. And we're going to be seeing the blood returning from the superior part of the body, the head and the upper limbs, through the superior vena cava into the right atrium. That blood from the abdomen and limbs, from the head and the upper limbs, is going to go from the right atrium into the right ventricle. From the right ventricle, that blood is then going to be pushed out through the pulmonary trunk, laying right on the anterior aspect of the heart. And that pulmonary trunk, indicated with the star there, just so we don't get too many labels in there, there it is, the star for the pulmonary trunk. The pulmonary trunk immediately splits into a left pulmonary artery that goes to the left lung, and the right pulmonary artery back behind the superior vena cava going to the right lung. From there, those pulmonary arteries are going to branch and branch and branch in the pulmonary circuit, or the pulmonary circulation, out to every part of the lung, to the alveoli, where of course it'll pick up oxygen, and then be coming back to the left side of the heart. From the left lung, they're going to come back through the left pulmonary veins into the left atrium. And from the right lung, it's just too hard to draw it in, but those right pulmonary veins are going to go back behind the heart also, and the posterior aspect of the heart into the left atrium. From the left atrium, notice that this blood that's coming back from the lungs is now red because it's oxygenated blood. From the left atrium, it's going to pass down into the left ventricle, going through the atrioventricular valve, and the left ventricle is then going to push that blood. You have to imagine you're looking into the heart, right up through the middle of the heart. There's the opening into the aortic arch, and we'll talk about it in a minute. It would have that valve, a semilunar valve around it, so it goes past the semilunar valve and around the aortic arch. As it goes around the aortic arch, you're going to have the major vessels coming off, head taking now oxygenated blood up to the head and the upper limbs. The aortic arch is going to, of course, pass back behind the back of the heart. Imagine it passing behind the back of the heart, and as the dorsal aorta at the dorsal part of the chest cavity, and then down into the abdominal cavity to the abdominal organs and the lower limbs, delivering oxygenated blood to every part of the body. That oxygen is going to, and every organ, those vessels are going to branch and branch and branch until they go to the smallest capillaries, deliver the oxygen, come back into bigger and bigger veins that are all going to come together again. And now we're back where we started, into the inferior vena cava, delivering what is now labeled blue, or deoxygenated blood, to the right atrium. And of course, the same thing up in the head and the upper limbs, branch and branch and branch out to all the tiny capillaries, deliver the oxygen, come into ever larger and larger veins, coming back into the superior vena cava, also into the right atrium, and once again from the right atrium through the atrioventricular valve into the right ventricle and out to the lungs. And so the blood cycles from the pulmonary circulation to pick up blood out in the lungs, back to the systemic circulation on the left side of the heart, atrium, ventricle, through the aorta out to the rest of the body, delivering the oxygenated blood, coming back through the veins into the superior vena cava, from the bottom part of the body, inferior vena cava, into the right atrium, right ventricle, and so on and so forth. So that's the pattern of blood flow through the heart. Now, what we want to take a look at next is that blood doesn't just flow through the heart, it gets pumped through the heart. And we want to talk about the cardiac cycle, or how it is that the heart pumps the blood. And when we talk about the cardiac cycle in its simplest form, there's two parts to it, systole and diastole. And accompanying each of these parts are the sounds of the heart. So this is the way to think about it. I think in simplest form, and it's almost intuitive. There's the lub-dub sounds of the heart Lub going with the systole, we'll see where the sound comes from in a minute. And dub going with the diastole, we'll see where the sound comes from in a minute. And also accompanying the two parts of the cardiac cycle are our typical measurements of systolic and diastolic blood pressure with their average adult normal measurements of 120 or 120 over 80, those numbers representing millimeters of mercury, Hg being that atomic symbol for mercury. That's just the way what used to be in the devices that measure pressure, a column of mercury, so that's why it's called millimeters of mercury. That's how high the column would go, and we still maintain that measurement. So systole is the lub sound when you have the high pressure number, 120. Diastole is the dub sound when you have the low number at 80. Well, where do the sounds come from? Why does the pressure change? That's what we want to take a look at. In systole, that's the moment when the ventricles contract. What do we mean by that? What's happening? Well, what's happening is the big, powerful ventricles, the large, thick-walled, contracting, muscular part of the heart that forms most of the heart, contract both sides together, left and right sides. The whole thing contracts together, and when they do that, they push the blood up through the pulmonary trunk from the right side and up through the aorta from the left side. And the question is, why doesn't that blood just go back into the atrium on either side? And the reason is those atrioventricular valves. On the left side, that atrioventricular valve is called the bicuspid valve. On the right side, it's called the tricuspid valve. Those little cusps snap shut, come together, so there's no way for the blood to go back up into the atrium. They come together, and these little chordae tendineae, the little cords, make sure they don't just get blown back up into the atrium. They just snap together, and that means the blood has to go out through the pulmonary trunk and through the aorta from each side of the heart. So that lub sound that we hear, the first heart sound that's associated with systole, the lub sound comes because when the ventricles contract, the atrioventricular valves shut, the cusps snap together, and we can hear that as an audible lub sound. The blood then gets pushed through the pulmonary arteries and also through the aorta, specifically on the left side, into the brachiocephalic, subclavian, carotid, dorsal aorta, out to all of the rest of the parts of the body, and in all the downstream branches of those arteries, there is now a surge of blood as the ventricles contract, raising the blood pressure, on average, normal in adult, to 120 millimeters of mercury. What then happens in diastole? In diastole, we have the situation where the ventricles now relax. The blood that has been pushed up into the aorta and the pulmonary artery would tend to just drop right back down into the ventricle, but there are these little pockets or cusps of the semilunar valves around the outside of the pulmonary artery and the aorta. The blood drops into those pockets and it forces them together in the middle of the exit for those big giant arteries, and they snap together, making what is more of a dub sound. So this time it's the semilunar valves that make the dub sound as the ventricles relax and the blood tries to drop back down into the ventricles. Since the ventricles are relaxed during diastole, the atria take advantage of that moment with their little tiny contractions to push blood into the ventricles. What does that look like? Let me show you. Here on the heart, remember the blood has been pushed out through the dorsal aorta, also the pulmonary trunk, because both right and left side work at the same time. Of course, they're divided down the middle. The blood doesn't mix. And instead of that blood dropping back in, the little, I can't draw them in on here, it's too busy, but the pulmonary, or the semilunar valves at the base of the aorta, at the base of the pulmonary trunk close, and now the blood that's in the atria on either side, and the thin-walled atria, just squirt that blood into the two ventricles, past an open atrioventricular valve, filling the ventricles, so now they're ready for systole again to push that large amount of blood out through the aorta, out through the pulmonary trunk. And so in diastole, when the atria, the ventricles relax, the blood, the valves, the semilunar valves close, and you hear that dub sound. The atria contract to push blood into the ventricles. There's no force pushing pressure into the aorta and into all the systemic arteries, and so you get a baseline normal average low pressure of 80 millimeters of mercury. So that 120 millimeters is at systole, the 80 millimeters, or the 80 number is at diastole. Just to recap real quick, this is a look at the blood flow through the heart and the cardiac cycle. And remember, what happens is if we start on the right side of the heart, the blood is returning through the inferior vena cava and the superior vena cava from all the systems of the body. Deoxygenated blood into the right atrium, passes through the atrioventricular valve into the right ventricle, gets pushed out through the pulmonary trunk to the lungs, picks up oxygen, comes back on the left side to the left atrium, from both lungs to the left atrium into the left ventricle through the atrioventricular valve. When the ventricles contract, pushed out through the dorsal aorta, through the aortic out to every part of the body. When the ventricles contract, those valves snap shut, creating that lub sound. You get a high pressure push of the blood through the aorta out the systemic circulation, causing that 120 high blood pressure reading. When the ventricles relax, the blood is pushed in from the atria. It can't drop in from the big vessels because the semilunar valves snap shut, giving you that dub sound. And because there's no pressure behind the blood, you get a lower pressure reading of 80 millimeters of mercury. That then is a look at blood flow through the heart and how the cardiac cycle works to pump that blood from big picture anatomy.